Hi there, I'm Andrea Dasky, your anchor here at SVSU News Network. Today we are going to have a segment on the Global Deterioration Scale, which is a 7-rating scale that is used to evaluate the course of Alzheimer's disease and its degenerative dementia. This was developed by Dr. Barry Reisberg back in 1982, and the scale is sometimes referred to as the Reisberg scale. This counts scores from formalized cognitive or functional performance testing, and it's different from other cognitive scales because it focuses more on the level of patient decline than anything else. It is a screening tool used by the therapist to observe and later interview the client, and it can be performed on anyone who thinks that they may be suffering from Alzheimer's dementia. Let's go to our on-site weather reporter to understand some more on the 7 different levels of dementia.
The first level of our scale is level 1, which is no cognitive decline. There are no subjective complaints of memory deficits or any evidence of memory deficits during the clinical interview. Very mild cognitive decline. In this level, there are some complaints of memory deficit, most frequently in forgetting where one puts a familiar object or forgetting other people's names. There is no objective evidence of memory deficits, and the clinical interview stage is mild cognitive decline or mild cognitive impairment. Much like this weather, the brain is starting to get a little cloudy. This is the earliest stage where deficits could be shown in areas such as anomias, loss of name recollection, or having a concentration deficit or retaining little to no information. Extensive interviews have to be done in order to fully comprehend that objective memory deficits are there and denial is starting to form, which may lead to some anxieties. I might want to grab a jacket for these next levels though. Stage 4 is moderate cognitive decline with mild dementia. The cloudy brain is starting to gather more precipitation at this point. There's a clear-cut deficit on this interview. The client possesses limited knowledge on recent events, decreased knowledge about personal history, and decreased ability to travel or handle their own finances. However, they are still able to recognize familiar faces and places, and they are very much in denial that the situation is happening to them. Stage 5 is where there's a moderate severe cognitive decline and moderate dementia. This bad weather is starting to pick up just a bit more in the brain at this point. A person can no longer survive by themselves, and they need some minor assistance, but they can still perform basic ADLs. During the clinical interview, they may not be able to recall significant information about themselves, like the names of close family members or where they went to school, but they can still recall some of these major facts in different settings.
Now, level 6 shows severe cognitive decline, and these people are completely dependent on their spouse. They're generally unaware of their surroundings, and their personality and emotional state are starting to change and display some delusional behaviors or obsessive symptoms. Anxiety has become very high and aggression has been shown towards others. As you can see, there's a full-fledged thunderstorm in the person's mind when they reach stage 7, the severe dementia stage. All of the person's verbal abilities are lost and they require assistance in all ADLs. Their basic motor skills are also lost. They've developed some rigidity and developmental neurological reflexes. To master the test, the therapist must first observe the client for any obvious symptoms. Next, they will interview the client to see if they have any subjective input towards the situation, and after that, the therapist can look at the GDS and determine what level of dementia the client is at. It is very easy to administer, only taking a few minutes and only needing the scale from the Alzheimer's website. The test is both reliable and valid, and it is reported to have good inter-rater reliability ranging from 0.82 to 0.92. The scale was also validated twice against biomarkers, and it was indicated that the GDS correlated with CT scans of ventricular dilation at 0.62 and CT scans of sulcus enlargement at 0.53. The domains evaluated include body functions such as memory, thought, and emotion, and body structures and process skills. Let's head over to our reporter Sandy with more on strengths and weaknesses. The GDS has many strengths, one being that it is one of the most widely used scales to stage the course of Alzheimer's dementia. It is also very quick to administer. It is both reliable and valid. It is also able to make predictions about a patient's ability to perform tasks and functions. However, there are some weaknesses. There's no clear distinction between the methods used and the clinical parameters of the scale. Each stage uses different areas of observation for behavioral dysfunction, so the areas being observed are not consistent with one another. The GDS also relies heavily on correlations between the progression of the scale and brain imaging data to determine validity. Able to predict the future abilities of a patient, the therapist is better able to plan out interventions. The GDS serves to provide caregivers with a rough idea of where the individual is in the disease process by observing behavioral characteristics and comparing them to the GDS.
By using the GDS, therapists can work with the families and caregivers to better understand the cognitive deficits of the patient. With this information, together they can set realistic goals and living situations for the client, and they can also determine a proper therapy regime to maintain independence and improve quality of life for individuals who are living with dementia. That's about all the time we have left today, so thanks for tuning in to our segment on the Global Deterioration Scale. I'm Andrew Dasky signing off for SVSU News Network.